Old habits are hard to break, and this past year, many people have gotten into the bad habit of ignoring their teeth. What's the harm, right? They've been covered by a mask. Now it is time to get back to those basics, though, and it's not just about having a bright smile. As my next guest can show you, it's also about your overall well-being. And joining me now, we have Dr. Jamie LaViola. He's a specialist in cosmetic dentistry. Good to have you on the show, Jamie.
Thank you.
You know, now that COVID restrictions are lifting across the country, and I want to mention your practice is in Virginia, tell us what you're seeing. What are some of the trends that are happening in the dental industry?
We're definitely seeing more of an influx of patients, especially that we see more people being vaccinated. And the other thing is because of the fact that COVID wouldn't allow patients to come in, there's a lot more issues that have kind of festered and gotten worse. And for some of the people that were waiting before COVID, they've gotten even worse. So just trying to manage a schedule, keep people healthy, and make people feel comfortable.
And so the common misconceptions patients have, what are some of those that you would say when it comes to dental health?
So there's quite a few, Robin, but the biggest one I'll go through is if it doesn't hurt or I don't feel it or see it, there's nothing wrong. And that couldn't be furthest from the truth. Some of the largest cases that I've had to do were people that didn't feel anything until I took a three-dimensional scan, was able to see it. And it just makes treatment go longer, more expensive, more visits, more time seeing me, which you don't want to. So it's important to realize that, definitely.
And there are some specifics as far as, you know, overall wellness kind of being attached to your gum health, to your dental health, right? So I want to talk about gum disease specifically. I know that can be a warning sign for other problems in the body. So what are some of those?
To sum it up, if your gums are bleeding, there's something wrong, whether it's with your teeth and they just need a good cleaning, or there's something wrong with the body. There's been 53 diseases that have been cited in literature that say that there's a associative effect, so not causative. So overall, bleeding leads to inflammation. Inflammation leads to holes in the immune system that can make it so that you can't fight off other things.
And stress also does that. That's an issue that many people don't realize. If you're stressed, that's going to relate to what's going on in your mouth.
Yes. So stress, we know, increases cortisol and other hormones and markers, which increases inflammation. That can cause sleep deprivation, problems with eating. And again, that all leads to issues with a weaker immune system, which allows less of that to work towards other viruses, like let's say COVID. I'm not saying it's a direct correlation, but that and other diseases as well have shown a direct effect with the immune system.
Now, Dr. LaViola, I know that telehealth is happening in the dental industry as well. Has that allowed patients to kind of get back into their habits? And how does that play into an overall treatment plan? Because we know that you have to be in person for a lot of these treatments and procedures.
Yeah. So telemedicine has been around for a while. In the dental world, I was fortunate enough to start working on something before COVID. And what it does for me is it allows at least people to meet me, understand what their problems are, see if we're a fit, so I don't waste the investment of someone's time or money if I'm not the right fit for them or we're not a right fit. And it also gets rid of some of their fears. Ultimately, they have to come to the office to get a diagnosis and a proper treatment plan, though. So it plays a part, definitely in dentistry, to break the ice, I think, and I think we'll move forward with it.
And I definitely want to let people know it is now, you know, safe and safer than not to get back to the dentist when you see just how much your overall health really relates to what's going on in your mouth. And it is something that can't be undervalued. So I want to let people know, get back to the dentist. You can find out more about Dr. LaViola at his website, which is drlaviola.com. So pretty easy. And thank you so much for joining us with the great advice today, Doctor.
Absolutely. Thank you.